everyone. My name is Daiva, and as Liz mentioned, I'm a health scientist with the Demand for Immunizations team at the US CDC. And I apologize, my colleague Francine was with me earlier today, and she helped me to develop this presentation, but she is now sleeping. So I will be giving this presentation alone, but you will see little hints of her throughout. So you can go to the next slide, please. All right, so for today, we're going to talk a little bit about why diagnostics are important for understanding vaccine demand challenges. We're going to talk about the process that you might be able to use for gathering community insights and for using those insights. We'll then talk about some guidance and resources that are available to you for diagnosing those vaccine demand challenges. And then we'll have a little group exercise, and I'll talk to you about what that is when we get there. Next slide, please. So these are your learning objectives for today. At the end of this presentation, hopefully you'll know a little bit more about why diagnostics are important for increasing vaccine demand and uptake. You'll learn the process for gathering community insights. You'll learn how to choose data collection methods, and you'll learn where to find guidance and resources for diagnosing vaccine demand challenges. Next slide. So why are diagnostics important? Well, diagnostics can help us to understand community perceptions, questions, or concerns about vaccination. They can help us to question our assumptions that we may have around why people are not getting vaccinated, those barriers and those enablers to vaccination. And they can help us to design targeted evidence-based interventions that will be used to address those community needs that you've identified. Next slide, please. And you may be familiar with this framework. You might have seen this before, but this is a framework that was developed by WHO, the WHO BES working group. And it's the behavioral and social drivers to vaccine uptake. And so you'll see here in the yellow box that what people are thinking and feeling, like their perceptions of disease risk, their confidence in vaccines, which includes their perceived benefits, safety, and trust. So all of those kind of thinking and feeling pieces, coupled with social processes like social norms, healthcare worker recommendations to get vaccinated, and gender equity, kind of work together towards getting someone motivated to get vaccinated or intending to get recommended vaccines. However, motivation alone does not lead to vaccination. As we know, there are a lot of practical issues that are involved as well. Things like availability, affordability, ease of access to getting vaccinated, service quality, the respect that someone's getting from their healthcare provider. And so really we want to think about all of these different drivers, these behavioral and social drivers that lead to uptake of recommended vaccines at the very end of this framework here. So as we kind of talk about diagnostics today, and as you think about your own community, really encouraging you to think about all of these different processes and all of these different drivers that might lead to someone getting there. Next slide, please. So this is a case study that I wanted to share from Haiti. So COVID-19 vaccine rollout began in Haiti in July 2021. But in February 2022, they found that only 2% of the population was fully vaccinated. So really, they were having a big problem getting people vaccinated. And so they were trying to understand why. And the Ministry of Health came to us here at USCDC and requested assistance with a rapid community assessment to try to understand some of those barriers to vaccination in the community. So I went out with a colleague of mine and we deployed for 2 weeks in Haiti. We went to Port-au-Prince, and then the team that we trained continued on to Miraguan and Fondé-Blanc. We did a number of different data collection methods. We were mostly conducting interviews and focus group discussions with the key leaders in the community and the community members. And then they also did a little bit of social listening as well. And what they found were many different things. So some of the things we heard were that doctors weren't recommending the COVID-19 vaccine to their patients. Some of the vaccination sites were too far away. The community leaders that were not getting vaccinated, people like church, faith-based organization leaders were not getting vaccinated. And so people were just wondering, if my leader's not getting vaccinated, why do I need to do it? A lot of perceptions that COVID-19 was not a problem there. Fortunately, they did not have as many COVID-related deaths. And so they just didn't think that it was that big of an issue. And then they also heard that the vaccine causes infertility, as well as many different other types of misinformation. So a lot of misinformation was circulating via social media and other channels. So these are just a few of the things that we heard from the community. And then we put those findings together and kind of shared back some recommendations to the ministry and stakeholders to try to address some of these challenges. Next slide, please. So this is the journey to vaccination. You saw this before. We did that exercise where we talked about the different barriers and enablers to vaccination in your community and in Fukile's journey. I just wanted to share this once more to really think about, again, as you're kind of thinking through the different drivers and barriers to vaccination, remembering that there's this really whole journey that one goes through to get vaccinated. So in the case of Haiti, you saw that there were issues in knowledge and awareness. There were problems with some of the logistics of getting to appointments, around communications. And so really there are all sorts of issues kind of along this journey. And it's nice to just kind of remember that and continuing to think about this journey. Next slide, please. So this process of gathering community insights and then developing interventions with the community is a process that we call human-centered design. You probably are familiar with this term. If not, we'll talk about it in future presentations. But I wanted to share this here because diagnostics is really kind of the first stage of this process of human-centered design. And it's just, this process is really just to design interventions with the community in mind and kind of along the community with you along each of these steps. And so it kind of, you can synthesize this process of human-centered design into these 5 steps. So the first step is to gather insights and perceptions from the community of focus. So that's that diagnostic stage that we'll be talking about today. Then we'll be synthesizing those findings and community needs. So analyzing some of those challenges and finding those key barriers. Co-designing interventions with the community. And I really say co-design here as the key because the community should be involved in designing those interventions. And then sharing those recommendations back to the community and stakeholders who are involved in vaccine programming. And then finally, implementing and evaluating those interventions to increase vaccine demand and uptake. So once again, we're just talking about this first stage of this journey today, but you'll be hearing about the other steps of this process later in your training. So the process for gathering community insights. What is the process? So we can really kind of synthesize the process into 5 key steps. The first is to determine your objectives. You'll then want to identify your community or communities of focus. You'll choose your data collection methods, then form an assessment team, and then recruit your assessment participants. And we'll be going through each of these steps in a little bit more depth. So that first step is to determine your objectives. And these are just a couple of sample objectives that you may want to use for your evaluation. To identify populations at risk for low vaccine uptake. Maybe you'll want to identify community leaders, trusted messengers, or important message channels that you can use to get messages out to the community. Assess barriers to vaccine uptake. And then identify, implement, and evaluate strategies to increase vaccine confidence and uptake. So just a couple of sample objectives here for you to think about. Next slide. And then you'll next want to kind of think about your community of focus. And it may be one community, it may be multiple communities, but there are many factors that you might think about when you're identifying those communities. So maybe you'll want to think about those who are experiencing low rates of vaccine uptake or confidence. Maybe communities who have historically low routine adult or childhood immunization rates. Maybe communities that have experienced disproportionately high rates of disease or death. Maybe those that have high rates of underlying health conditions that might place them at greater risk for severe disease. Or maybe communities that are likely experiencing barriers to accessing vaccination services, so some of those physical barriers. So maybe just really thinking about in your community, what might be those communities that you want to really focus on for your assessment. Next slide, please. So choosing data collection methods. This is our third step. And I saw that when we did our initial polling, many of you have done CAP surveys or other types of surveys. So you probably are very familiar with this method. A CAP survey is a knowledge, attitude, and practice survey, and it's very, very popular for understanding barriers to certain health behaviors. But they may not be always appropriate for every situation. And I just wanted to share this here because I know that they are often used, but we want to talk about some of the other options for data collection methods. So CAP surveys are really useful for understanding misconceptions or misunderstandings in the community, for identifying information gaps, and for establishing a baseline understanding that can be further explored in other assessment methods. However, they tend to be descriptive. So that means that they don't necessarily have a framework for intervention creation. They tend to be quantitative unless you have a lot of open answer responses. Otherwise, they're really quantitative, which sometimes fails to capture some of the nuances or context within the community. They're often done at a national level, not always, but often they are done at a national level, which is ignoring some of the local variations. And what we know is that, vaccine perceptions and perceptions about health behaviors are so variable within the community, within a country. And so we really want to be looking at the really local level. And then they're often static, so they don't capture dynamic situations that are changing a lot. And we know that people's perceptions are constantly shifting. And so that's one of the pitfalls of working with the CAP survey. Next slide, please. So these are just some of the considerations that you might think about when you're choosing your data collection methods. So first, thinking about your available resources, and this could be resources like time, money, human resources, what do you have available to you? Also thinking about any existing data sources. So if the country has already done a lot of CAP surveys or a lot of other quantitative surveys, maybe you want to supplement that with some qualitative data. If there's been a lot of focus group discussions in a certain community, maybe supplementing that with some social listening data, really thinking about what has been done and where are the gaps. And then also identify existing community partnerships. So who are your partners in the community? Who might you be able to collaborate with, and what are they doing, to think about where you need to go. Next slide, please. So I'm going to go into a little bit of depth into each of these different data collection methods. Again, you might be familiar with many of these, but if not, just a little bit of an overview. So surveys and questionnaires, again, these are predetermined lists of questions that are given to a group of people. They can be self-administered, like in an online survey, or they can be administered by a data collector in person. And they can be quantitative, like I said before, with a kind of predetermined list of options, or they can be qualitative, which means that there's more open-ended questions that people are filling out. When are they useful? They can be used when questions or hypotheses are clear and generalizability is desired. Next slide, please. Interviews. So I saw in our initial polling that many of you have conducted interviews before, which is excellent. These are conversations with individuals to understand details on their personal feelings, opinions, or experiences. They can be formal or informal, and they can be structured or unstructured or semi-structured. So there's a lot of different variations in interviewing. When do you use them? When you're really trying to understand more complex or sensitive topics that you can't really get via a quantitative survey. When questions or hypotheses are unclear and you want to get a little bit more detailed information. And when more detailed information is required. So often these are done with key informants in the community, with community members themselves, with healthcare workers. So yeah, they're very popular and they're very, very useful. Next slide, please. I also saw that many of you have done focus group discussions, so you are probably very familiar with these, but if not, they're discussions with a small group of people. So they're kind of similar to the interview, but with a kind of more group of people rather than an individual. They do require a skilled moderator. And so that is one of the kind of challenges of working with focus groups. When to use them, when data or insights generated in a conversation would be more accessible in a group setting. And they can be more efficient than individual interviews because you're able to talk to many people at once. And they can also be a little bit useful when, people are able to kind of feed off of each other in this kind of group setting way. So they can be really great for that. Next slide, please. Participant observations. So I'm not sure if I saw any of these in the polling, but these are methods where a researcher is immersed in a community in which they're studying, and they're kind of observing that community and just writing down what they see and what they hear. These data can be collected, can be qualitative or quantitative. And you'll use them when you want to gain an understanding of the context in which study participants live and their behaviors. And they're really powerful for capturing detailed and accurate information about individuals or communities. Because what we know is that what people say is not exactly often what they do. It can be very different. And so we can kind of hear what people are saying that they're doing. And then when we're actually immersed in the community and we're watching them and we're, kind of living among them, we can know a little bit more about what they're actually doing. And so when we were, I just wanted to say one more thing. When we were in Haiti, we did a lot of observations of vaccination sites and of healthcare facilities where we could watch the vaccination sites in action and see what people, who was coming and how they were rolling out vaccines. All right, next slide. Great. Okay, so social listening, and you're going to have another presentation right after this on social listening, so I'm not going to go too much into depth here, but just a little overview. So social listening or media monitoring is monitoring social or traditional media channels for mentions of a specific topic. This is looking at things like Facebook, Twitter, Instagram, YouTube, or traditional media channels, journal articles, newspapers, radio, to kind of hear about, what are people saying, what are the conversations that people are having. It can be really useful for understanding online and media conversations around a topic, and it can be used to determine trends, information needs, and circulating mis or disinformation that is circulating in social media. So again, you'll hear more about this in another presentation, but just an overview. Next slide. So step 4, so now that we've kind of identified which assessment methods we want to use, we now need to form our assessment team. So these are the people that will be carrying out your assessment. And so we really want to consider including people who might be members of the community itself. And this can be useful because they are often trusted by that community, and they often speak the same language as the community, because especially in the global space, language barriers can be a challenge. So in previous assessments, we've often used healthcare workers or community health workers who are members of the community. You can see here in this picture, this is a rapid community assessment that we conducted in San Mateo County, California, where we were trying to understand COVID-19 vaccine uptake among youth, around teens. And so we actually worked with teens themselves from the Boys and Girls Club, and we trained them to be data collectors, and then they went out and interviewed and talked to their peers. So it can be nice to kind of work with that community. As well as individuals with existing knowledge about the community of focus, or people who might have experience collecting and analyzing behavioral data, so that we don't need to be doing quite as rigorous of a training for people. Next slide, please. So step 5, after we have our assessment team in place, we want to start recruiting our assessment participants. So thinking about getting a real broad mix of people within your community of focus so that you can hear all different types of perspectives. So this might be including people of different ages, gender identities, races or ethnicities, primary languages, national origins, education levels, occupations. This is just a small list, but really thinking about how can you include every different type of perspective from the community of focus so that you can make sure that you're representing that community well. Next slide, please. So the first step for recruiting assessment participants might be to think about those key stakeholders in your community, those people who are invested in your community of focus and in the implementation and outcomes of those vaccination programs. So this might be healthcare workers, health system leadership, social service organizations that are working with your specific community of focus, potentially government officials or elected leaders. Faith-based organizations have proven to be very, very useful, as well as employers. So thinking about who might be those initial key stakeholders in your community. Next slide. And then once you've talked to a couple of key individuals, we like to use a snowball sampling approach to identify additional participants. And what this means is that you're just talking to a few individuals at the beginning. And with each person that you talk with, you ask them, who else should I meet? Who else should I speak with in the community? And if each of those people can give you 1 or 2 additional people, you'll quickly have a very big representative sample of your community. So this is a really useful approach, especially in a rapid assessment where you don't have the time to really think about your entire sample in the planning stages. It kind of allows you to to meet people and to keep going as you progress throughout your assessment. Next slide, please. And if you are planning to conduct observations or intercept interviews, which are interviews that you conduct with people in a public setting, you just kind of go up to them and say, can I speak with you? If you are planning to do those types of data collection methods, it can be useful to identify some of the places where you might want to do that, where you might want to speak and observe people. And so really thinking about some of those kind of public spaces where you might see a lot of people within your community of focus, places like vaccination sites, or if you're working with youth, maybe schools, healthcare facilities, restaurants, bars, community markets. I can say when we were doing rapid community assessments here in the US, we went to a wide variety of places, all types of different farmers markets, restaurants, bars, just different public spaces where we can just start speaking with some of the community members. Next slide, please. So here are just a couple tips for implementation. It can be helpful to really clearly plan some of the roles and the timelines ahead of time so that you have a clear, plan and way forward. stay connected. So continue to have stakeholder involvement from the beginning, and frequently check in with your assessment team. And this can help with really kind of moving the progress of the project forward. And also it can help with your analysis at the end, if you're constantly checking into with your assessment team and kind of doing these debriefs on a frequent basis. And then adapt as we learn. So just a note here to create space for reflection and review and allow flexibility in your plans. I can say firsthand that many of the assessments that I've done in the past, while we were trying to have as much of a clear plan as we could from the beginning, things just constantly are shifting and changing. And so really allowing that flexibility and allowing it to be an iterative process can be really useful. Next slide, please. So this is a diagram that came from the Human-Centered Design HCD tip resource that UNICEF has put together, and I'll share that later. But this is just kind of to show that this is an iterative process. It's not linear. It kind of has this circular it is circular. So we're here in this diagnostic stage at the beginning. You'll then get into your design stage where you're designing those interventions. You'll then implement the interventions and evaluate them. And they show that this is kind of circular. So you'll constantly be designing, implementing, evaluating, and then fixing, implementing, evaluating, and then getting feedback, and then implementing again. And so it's really good to know that, we're not going to just go forward and everything's going to be great the first time. There is constant change and fixing of the interventions. And I think that this diagram is actually kind of missing a little bit of like a dotted line to the diagnostic stage, because oftentimes you may need to go back into that community and re-diagnose and ask more questions of the community and make sure that they're continuing to be included in that process. Next slide, please. So here are a few guidance and resources for diagnosing vaccine demand challenges. So I've talked a lot about rapid community assessments. This is a guide that our team at CDC has put together. It's very robust, and it's a process for better understanding and addressing community needs around COVID vaccination specifically, but can be used for other vaccines as well. And it can be done in as little as 3 weeks, so very, very rapid. It includes step-by-step guidance and tools. So there are a number of different tools in here for many different types of data collection methods that you might want to use. So there's a key informing interview and listening session guide. There's a form for conducting observations. There's a question bank if you want to put together a survey. There's tools for social listening and media monitoring. And then there's a tool for synthesizing your data at the end and putting it all together. Next slide, please. And then this is the HCD tip resource that I talked about. It was developed by both UNICEF and WHO together. And it was kind of a way of putting together the human-centered design resource that UNICEF has. It's a very robust resource for designing interventions for health behaviors. And then the tailoring immunization programs resource that WHO had. So they put these two kind of very, very robust resources together and created this more kind of user-friendly, kind of more a little bit shorter resource that can be used for really talking about the process for human-centered design for immunization programs. So it can be used as part of micro-planning or to better support better workflows for healthcare workers. And it's really designed to be people and community focused, broadly applicable, adaptable, easy to use, and usable at the community and health facility level. So both of these resources will be shared with you in PDF form after the training. Next slide, please, or after this presentation, I think. And then finally, we have the behavioral and social drivers of vaccination. So again, I showed you guys that framework that showed the different, colorful boxes for the behavioral and social drivers to vaccination. And this is the resource where that came from. So the tools and guidance for measuring the drivers of demand are included in this guide. It also includes a behavioral framework for what drives uptake, ready-to-use surveys. There's a survey question bank that can be used, and adaptive qualitative interview guides. And guidance on analysis and templates for reporting. So again, all of these resources will be shared with you. Next slide. So 3 truths for guiding principles for practitioners. Keep it simple. So really just trying to think about what is the information that you need to gather for your community? What is that actionable information? And really trying to narrow it down to those key questions. We don't want to create a super comprehensive survey. When we're doing a rapid survey, we want to keep it as simple as possible. And then kind of along with that is considering how you will use the information you want to gather. So before putting together your assessment, really thinking about what you're planning to do with it. Tina and Liz talk a lot about data hamsters. I'm sure they'll talk about that in later presentations, but the idea being that we don't want to be data hamsters. We don't want to be constantly chewing on data and mulling over it for days and weeks and months. We want to be able to use that information and really make it actionable and turn it into recommendations and interventions. So that will be that's a key point here. And then involving stakeholders and priority groups from the start. So involving stakeholders from the start is really important in terms of that transition stage, taking those data and turning them into action and making sure that those data are being used for action. Involving those stakeholders from the beginning really helps to ensure that. And the priority group kind of goes back to that the idea of human-centered design again. So really wanting to make sure that the group, that the community of focus that you're planning to that you're designing for is involved in your design stage from the beginning. They're involved in the behavioral insights and then in the design of those interventions, and then even into the implementation of those interventions. You want to make sure that they're centered in that process. Next slide, please. And then here are just 3 best practices. So use behavior change frameworks to inform assessments. I've shared a couple of with you already. Highlight your assessment tools before conducting full-scale assessments. I'm sure that this does not come as a shock to you, that it's very useful to make sure that your assessment tools are understandable by the community and that they really work to collect the information that you need. Ensure that the assessment team is well trained on those data collection methods, especially if you're using a method that they may not be familiar with or don't have a lot of experience in. Providing training for them is really useful. And then conducting that training alongside real practice. I found that this is a really useful technique. I can speak to that case study that we did in Haiti. We were training a group of data collectors, and we trained them on the data collection process, and then they went out and collected their data, and then we came back and we trained them on how to analyze those data in real time, and they did that with us. And then we went on to train them on how to turn those findings into interventions. And so that was kind of done all alongside the real practice, and that made it really practical and useful for them. Next slide, please. And then these are just some actions that you can take for diagnosing demand challenges in your different environments. So the mountain bike here is kind of the most simplest type of assessment that you will want to do. Keeping it really simple, collecting only the data you really need, simplify your tools and materials, really try to coordinate with other partners for added support, because this is a situation where you may not have resources to be doing a really broad assessment. So, see where you can get that extra support. Consider existing or planned activities that you can piggyback on. And then if you want to get a little bit more heavy, a little bit more of a sturdy 4x4, you might want to think about planning a rapid assessment and building off any existing data that's available to you. Form an assessment team who can collect and synthesize data very rapidly in a 2 to 3 week timeline, maybe. And then finally, that luxury vehicle option is to invest in building local capacity. So this is where you're wanting to really try to create a sustainable system where they're collecting data over time, maybe a longitudinal study where you can see some of that change over time. All right, so we are now moving on to our group activity.